Warm welcome to all of you who are joining the live stream. You may have just received a notification on Facebook, LinkedIn, wherever you're watching. I'm Reda Sadki from the Geneva Learning Foundation. Together with Charlotte and Boo, will be your hosts for this special event on female genital schistosomiasis. We'll be starting in just over 4 minutes. You can see the countdown here. Make yourselves comfortable, listen to the music, and get ready to hear stories, first-hand stories of people who've decided to take up the challenge of female genital schistosomiasis where they work, wherever
Recording
that may be
in progress.
in any of the endemic countries. See you soon. Pour les francophones, c'est un événement bilingue. La traduction, l'interprétariat sera assuré dès le lancement, donc à l'heure qui vient, 17h, heure de Genève. For Anglophones, language interpretation for those of you who are with us in our Zoom studio will start at the top of the hour. See you soon. welcome to you from Geneva, Switzerland. I'm Reda Sadki from the Geneva Learning Foundation. Very pleased to be here with my colleague Charlotte Mbou. Charlotte, how are you doing? What are we doing here today? Hello, Charlotte.
Me?
All right. And I think I could not hear the English channel, so maybe if you can check if there's anything you can do with the interpreters, and to make sure if the francophones could confirm that you are in fact hearing the French channel will get started. We are offering simultaneous interpretation pour les francophones. Vérifiez, confirmez dans le chat que vous entendez bien
French speaking,
le français.
could you confirm in the chat that you do?
All right, and so we are kicking off this event today on neglected needs of women's health, les besoins négligés de la santé des femmes, avec un focus bien sûr sur la bilharziose génitale chez la femme. Alors, first of all, a few practical issues. How do you activate interpretation in French? So you click on the interpretation icon that you'll find if you're on your phone. It may look a little bit different, but look for this little globe. Once you find that, and I'll go to the English as well. It's the same thing to hear. Make sure you hear only English throughout this meeting. And so here you will click on interpretation, choose English, and then make sure you mute the original audio. That should make things a lot easier for you. And then the other thing is this is going to be very much about your participation. So in order to participate, you'll need to raise your hand. How do you do that? Again, you have to go to the three little dots that say more and then click on raise hand. And that is when you can actually, we will actually consider opening your microphone. You will not be able to unmute on your own just because of the sheer number of people that we have in the room. So what is this about? In May and June 2021, over 300 health professionals in sub-Saharan Africa participated in the fast package workshop on female genital schistosomiasis. What came out of this workshop? Well, working together for the first time, you had more than 200 people who developed local solutions, who thought through their situation, analyzed their context, and figured out specific actions that they wanted to take. Now, how participants prepared for action, you can see here. First of all, it was about analyzing their situation, explaining what do others need to know to understand that situation, and then setting a goal. All in all, you can see here the number of participants from each of these countries who actually developed an action plan specific to their context, whether they are working in a health facility, in a district, or at the national level. Now, today's event is a little bit different. It's about the Impact Accelerator, and we really see it as the next stage. Once you have figured out what is the situation, what you want to do, at the Geneva Learning Foundation, we've developed something called the Impact Accelerator, and that's what we're going to be telling you about today. Before I do that, though, I want to highlight some of the folks and just greet a few of the people who have joined online. If you are an English speaker, you're able to watch the live stream on Facebook, LinkedIn, YouTube, and Twitter. So we have Oni Ilofe Enejo, who says, I'm glad to be here. Oni Ilofe, please tell us what city and country you're connecting from. We want to know. And tell us how you are involved with respect to the prevention, diagnosis, treatment of female genital schistosomiasis. Rosalia Santi joins us from Indonesia. And Esfundo Gratitude joins us from South Africa, from Joburg, and is here to learn about FGS, in fact. Eddie Gidding Sr. says, hi, everyone. Tell us, Eddie, where are you connecting from? Just add another comment so we know where you're coming from. And then Ahmed Farah says, is coming in from Somalia. So that's what we've got so far. And now I'm going to tell you what is this accelerator. So first of all, we realized that it's not about a platform of some kind. It's not even about the network. It really is about you as a health professional, as someone who cares about the health of people in the community that you serve. It's about your leadership, your capabilities, your potential, your commitment. And this is evidenced by your effort and persistence, your willingness to help others, your allegiance to each other. And this is driven by these three things: your commitment to impact, your organizations, and your country's commitment to the same. So the Impact Accelerator is something we first built in July 2019. And in today's session, you may get to hear from some of the folks who were there to help us co-design and build this Impact Accelerator, and who'll tell you what difference it has made for them. Because we're now going to look at what can this accelerator do for people who have decided to take action around female genital schistosomiasis. So we have, in the accelerator, there are 4 pillars that you can see here. So first of all, it's about taking a pledge. And the pledge in this case, this was 2 years ago. This was for folks who work in immunization as part of the Ministry of Health, very often the expanded program on immunization. It was about making that commitment and making that moral commitment to each other, as well as to serving serving people in need. Second, third, and fourth pillars are about measurement, sharing, and mobilization. But it's not just about that. So I want to start with a pledge, and I'm going to go to Charlotte so she can read to us and share with us through the emotion as she reads it, what this pledge is actually all about. Charlotte?
Thank you so much, Reda. I hope you can hear me because connectivity is acting out my way.
I'm sure you're not the only one.
I'm committed to work for a world where everyone, everywhere is protected from neglected tropical diseases, and especially female genital schistosomiasis. As a scholar, I hereby solemnly pledge to work with others to transform projects led by scholars into action and results that will improve health outcomes. Share my success as well as my challenges by reporting on a regular basis on my progress towards implementation, and support fellow scholars in doing the same while upholding the highest standards of integrity and behavior. I make this pledge to contribute to the global goals for the health of women, men, girls, and boys in my country and everywhere. Thank you very much.
So ask yourself, is this you? Do you recognize yourself? Could you see yourself taking this pledge and making this commitment? You may not be ready for this, for a pledge like this, to make that kind of commitment. Keeping up with daily work may be more than enough already what you can handle. But for those of you who have that yearning to go further, to do more, this today is what we're hoping will be an opportunity to connect with others like yourself who want to go further in order to share through the Impact Accelerator and in order to mobilize as well. And you can see here from the July 2019 Accelerator what the experience was, but that doesn't really tell you the full story. And I'm going to turn to Charlotte in a minute, and she'll tell us if there's someone in the room who's actually experienced the Impact Accelerator that we're going to be inviting you to join if you're ready to make that commitment. In July 2019, there were 644 people who joined the very first Impact Accelerator. And something remarkable happened. These were people who had never met, and yet, over a period of 4 weeks, they met intensively together to learn from each other, and went from the digital space where they had connected online through WhatsApp, through websites, through whatever works, and decided to actually sit around the table together. Of course, this was pre-COVID. This is in July 2019, and figure out together how to go from knowledge to action, how to take action plans that they had developed around urgent needs and immunization in another area of health, and figure out how to accelerate in order to do faster, but also go together. So we are together, nous sommes ensemble, was one of the key messages that people kept repeating to each other as to why they were coming together on their own time, on their own dime, in order to go further and to make a difference. So you can see some of the pictures here, but before we tell you about the FGS Accelerator, I'm going to turn to Charlotte, and she's going to tell me, do we have in the room one or more people who were who helped build the first Impact Accelerator? And if so, could we hear from them firsthand?
Yes, Reda, we have with us a number of scholar alumni. I just invited Obed and Nobe from Ghana, who was with us in 2019 when we launched the very first Impact Accelerator. So Obed, I've invited him to unmute himself, and I'm sure he'll be able to tell us about his experience.
So
Over
Obed,
to you, Reda.
Yes, please introduce yourself, Obed. Who are you? What do you do? Where do you work? And then tell us, what is this Impact Accelerator all about?
Thank you very much, Rida. Good afternoon, good evening, good morning, wherever you are connecting from. I'm Obed Philip Nobe, Public Health Officer, Health Information, connecting from Agunam Kwanta, Ahanta Municipality in the Western region of Ghana. I'm really happy to be part of this very important event. Indeed, we were privileged to have the opportunity to be part of the first Impact Accelerator in July 2019. Indeed, that event actually helped some of us, because we were trying to, even though we developed the project, we were now looking at how are we going to implement this project. But within that 4 weeks, it gave us a full overview of exactly what we are going to do, because we're going to test a portion of the action plan that we've developed. And within that period, we started looking at all the resources and stakeholders that can help us to be able to implement it. And after testing it, in particular, I was working on TD2 Plus. As at the time, I was working in Swaman in the Western North region. And by the end of that session, within the 4 weeks period, we saw a clear change in the TD2 Plus that we were battling with in our district by then. So, Rita, indeed, the Impact Accelerator was an excellent one that helped us to actually rethink through the entire plan that we had developed for a period of 6 months, but wanted to test a portion of it within the 4 weeks that was given to us.
Thank you, Obed Dubois, young doctor from Ghana, did some remarkable things, sent us a hockey puck graph showing the change in vaccination coverage, and that was part and parcel of the Impact Accelerator. Today, we are here to speak about the neglected needs of women's health, and specifically female genital schistosomiasis, just a few months after over 200 participants in the FGS workshop came together and started thinking about what actions could they take, what actions would they take. 118 of that group of more than 200 FGS scholars were invited to submit their application, and as part of their application were asked if they would pledge to achieve impact. And indeed, 118 of them have now made that pledge, not for immunization, but for FGS this time, to get ready for the accelerator. Now, we're going to go to Charlotte, and she's going to invite folks who are alumni of the FGS workshop and who shared successes, lessons learned, challenges. And these are the questions. These are 9 of the questions that, if you're telling your story, if we're going to hear from you today, think about, make sure that you focus on what is important, and make sure that you focus on these things so we can understand your story and the remarkable work that so many of you have done following the workshop. So we are going to start, I believe, Charlotte, with success stories. So I hope your connectivity is holding up. Yep.
Thank you, Reda. I'm trying my best with that. So I'm going to start first with maybe you talked about success stories, but let me see.
Doesn't have to be a success story. Yeah.
Yeah, so I'm just going to invite Judith and Chan Kimbi. Her microphone is already activated. She's an alumna of the FGS workshop, and she's going to tell us what she did after that workshop as far as her action plan is concerned. So over to you, Judith.
And you can see, you should be able to see on screen a summary of her story. Welcome, Judith.
Yeah, good afternoon, everyone. I hope you're getting me.
Loud and clear.
Yes.
Yeah, okay. So as I from our last first workshop, we had a problem with our context. We tried to refine and redefine the context in which we are going to do our action plan, and we came across this small village, a camp, and we realized that in that camp is a camp where the Germans built a long way in the First World War, and the individuals who live in that camp are highly exposed to schistosomiasis, and that particular village is being surrounded by two streams. So, and they rely on the stream for their daily domestic activities. They don't have taps. The taps are not functional. Even their toilets, they are not functional. So they depend solely on the stream. And when we went further and investigated, we decided to find out from them if they know anything about FGS. They said they have no idea, but they know something. They know about UGS because most of the children, they have observed that children pass out blood in urine. So this kind of struck us much because even the health community worker, the health provider, they have no clue about FGS in this area. And the health district, it's around, but they don't know if they can use pelvic examination to diagnose FGS. They use pelvic examination for other urinary infections. And some of the women also express some worry, some concerns about some medical conditions, ill health, like itches, abdominal pains. And their suspicion is that they link these health conditions to the stream. So that again, it's something which we have to look into and really investigate to what level, to what extent are these individuals exposed to female genital schistosomiasis.
Dr. Judith
and I think
Anshan-Kimbi, thank you for sharing this so far. You heard about today then the pledge of the scholar, and I'm wondering, as you were working on this, you've already done significant work, it seems, since the FGS workshop. Does the pledge make sense to you? Is this something that you feel you are ready to commit to?
Yes, the community need a lot of help. They need a lot of help. And I think that with the motivation that I will get from this, I hope that I'll have all the mentorship to impact.
So if you join the FGS Accelerator, you'll be working, of course, with your colleagues in Cameroon, but you'll also be connected to practitioners in many different endemic countries. You'll also be connected to global experts who've worked in some cases on FGS and advocated for better prevention, diagnosis, and treatment of FGS for decades. What difference do you think that will make for you with respect to the work you are already doing? You did not wait for this to take action. What difference do you think it can make for you?
Well, I will feel I'm impacting something. I will feel I will achieve if I can go to that level to raise the awareness and let the people know how serious this disease is. And in my own little way, I think that I will feel happy that I'm able to solve a problem. Yeah.
Thank you. And I'd like now to turn to, Julie Jacobson. Julie Jacobson of Bridges to Development is one of those global experts who has been working on female genital schistosomiasis and fighting so that it's no longer a neglected tropical disease. Julie, a warm welcome to you. We just heard our first story shared by Dr. Judith Anshan-Kimbi. What are your thoughts as you listen to her and the dilemmas she's facing?
Thank you, Retta, and it's a delight to be here with so many amazing people trying to take on this challenge of the hidden burden of female genital schistosomiasis, which is throughout sub-Saharan Africa. And Dr. Judith, you've done a wonderful job of recognizing one of the key pieces is how are people exposed to the parasite. And so it comes from exposure to water sources that have been exposed to the parasite and have snails, which increase the level of parasite in the water. Contact with that water is the parasite goes through the skin and then infects the individual. If a village has urinary schistosomiasis, then they have genital schistosomiasis. It's the parasite affects not just the urinary tract, but the genital tract. It's just that people don't recognize the symptoms that they have, and they're frequently considered to be sexually transmitted infections. It causes birth issues. It causes infertility. So you are exactly on the right path here. Finding those villages that are at risk and exposed, prevent that exposure, try and help take care of the environmental pieces, let the villages know that they are at risk of these symptoms, how to get treatment, and make sure that they have availability of praziquantel to treat the population, not just the girls and the women, but the whole population for their exposure to schisto and prevent that. So you're on the right track. You've done an excellent job. I'm really excited to hear about the work and your pledge to take this on, because it'll only happen through all of these active and beautiful minds that are here today in your own country, seeing what's happening and being able to solve the problem as you see it taking place in your current setting. So thank you.
All right, thank you, Julie Jacobson. And you'll be hearing from many of the other subject matter experts who really went above and beyond to support practitioners in the FGS workshop in May and June as part of the FAST package, this amazing project to bringing together many practitioners from the global to the local levels. Now, let's keep going. Before we do, though, I want to acknowledge a few of the people. I'm not going to be able to acknowledge everyone, but we can see your messages. We appreciate the hellos. Don't hesitate to come with questions, comments, feedback. So we have Josephine from Nigeria. Hello to you. Let's see, Aja Kande from the Gambia. And do tell us the city and country if you're comfortable doing so. Ajay Frank from Ghana. All right, and Naji GM is connected on YouTube and connected and following, but we don't know what city and country. Mary Rufus from Sokoto, Nigeria. Anibel Bwalia from Zambia following via YouTube, and Barry Annie Gariba from Cameroon. We'll stop here for now. Back to you, Charlotte. What is the next story that we're going to hear? Success, lesson learned, or challenge?
So right now we are going to listen to a success story from Sedonia Abapori Adabuga from Ghana, who shared what she learned from the workshop with her colleagues that led to the diagnosis and treatment of a patient with FGS. Sedonia, your mic is already unmuted. Please go ahead and start by introducing yourself.
Hello, good afternoon, good morning, good evening to everybody, wherever you are connecting from. I'm Sidonia, as she rightly mentioned, from Ghana in the Upper East region. I work in a district called Talensi in Ghana, Upper East. I work as a nurse, but I'm in the public health unit at the district health directorate. So after my first session, I went and met management and discussed whatever I learned with them. So my director was happy, and then she asked that as part of my action plan, said I wanted to meet with the physician assistant, the medical assistants who work at the sub-district level. So we met them and shared the course material with them. And then we were able to meet the hospital medical soup. We intended meeting all the prescribers, but we didn't get the opportunity, but we were able to meet the medical soup who intended to also share the knowledge with the other prescribers and then the lab technicians. But on the side of the sub-district level, because they are far away in the communities, one of the medical assistants said he had one suspected case that the lady kept coming with recurrent infections. We also had a midwife who was trained to screen the cervical cancer. So they suspected, and then she did the examination for cervical cancer, which was not present. So they decided to treat for the female genital schistosomiasis. So after the first dose, the lady was okay. So they reported it as one of the cases that we have successfully treated. Even though we are far away, we've not been able to get the laboratory investigations. But once she was administered with the WEMA, she was okay. And then the others are still looking out for people like that. But what we intend doing to increase the suspicion and then possible treatment is to meet more of our staffs in group. Because we are far away, it's difficult to usually gather the staffs. So our next step is to go around as and when we are able to meet each sub-district members, then we'll share the course content with them to help us get a lot of cases being diagnosed. Thank you very much.
Thank you, Sidonia Abapori Adabuga from Ghana. Going to go to Amadou, Dr. Amadou Garba Jirme from the World Health Organization in Geneva. Amadou, would love to hear from you. This is the WHO Atlas being used in the field. I'm sure you have heard stories and supported people like Sidonia many times. What are your thoughts as you listen to her story?
Thank you, Reda. Good afternoon, good morning to everyone. I'm really happy to be here with you in this workshop to listen to the applicant to the previous training that we held. And from WHO point of view, we think that presumptive treatment for FGS is really what should be done in areas where there is a lack of diagnostic tools or diagnostic capacity. And this is exactly what we did. And I think this is really important for the other participants to this call to know, because the medicine that is used is safe, it's praziquantel, it will not harm, but it will provide treatment and also care and relief to the woman suffering from FGS. So we have developed this this atlas for FGS, which is available both in French and English, and it is for health professionals to be used in their daily work when they see lesions that are not usually linked to the other genital pathology, so that they can think about FGS and give this presumptive treatment. Thank you, Reda.
Thank you very much indeed, Dr. Amadou Garba from the World Health Organization in Geneva. I want to now go back to Sidonia, because Sidonia, you've heard now about the Scholar Pledge, committing to work in a world where everyone everywhere is protected from NTD. So I want to ask you the same question I asked our first speaker. What are you feeling? Do you feel ready to take this pledge and to keep working in the way that you've been to go further, faster? And we'll have to unmute Sidonia. Let me just see so that we can hear her answer. But all right, for some reason I'm not able to unmute her. I don't know, Ja, who is our host, if you are able to unmute Sidonia, because I think this is an important question, and this is what the Accelerator is about.
Yes, I've been unmuted.
All right, yes, please go ahead. Tell us, are you ready to make this commitment?
Yes, I am very ready, because I do work with adolescent girls in my district, and then I see how most of them, when they have problems, they are unable to come out and share unless someone gets close to them. So if we are able to get down to them and to really share and spread the information, I'm sure we'll be able to save a lot of people who are having infections and then they are not coming out with it. So I'm ever ready. Thank you.
Thank you very much indeed, Sidonia. Here you can see the pledge that we'll be asking FGS workshop alumni to commit to each other, to supporting each other, to actually achieving impact by joining when they join the FGS Impact Accelerator. All right, we're now going to go back. We've just heard 2 stories, and already there's so much there in these stories and in the efforts being led by practitioners from endemic countries. Charlotte Mbou is going to guide us to our next story. Is it a success, a lesson learned, a challenge?
Thanks, Reda. I think it's a success, a story that's coming all the way from. We have Grace Kwake Zime Mungame that's with us here. She'll be sharing with us how after the workshop she was able to get FGS to be integrated into the university curriculum through the sensitization of decision makers and more. Donc, Grace, si vous pouvez activer votre micro, vous avez la parole. I am asking Grace to unmute.
Yes, so
I hope
right,
she's...
There's always a little bit of time, and maybe we won't get to hear from her this time because of connectivity issues, and that's okay.
Yeah,
it's unfortunate.
So maybe
okay.
If we can't hear from Grace, I'll turn towards Huguette. Huguette, that is also a colleague from her country, from Democratic Republic of Congo. Huguette, who was able to do a training, an FGS training using WhatsApp to train other medical doctors and sensitize them on FGS. Donc, Huguette, si vous pouvez, okay, your mic is unmuted. Huguette, you have the floor.
Bonsoir à tous.
Good evening, everyone.
Bonsoir Huguette, on vous écoute.
Bonsoir à tous.
Oui, allez-y, Huguette, vous avez la
Yes, go ahead, Huguette. You have the floor.
Unfortunately, Reda, it's as if we are having technical issues.
All right, well, this is in French, so let's summarize and let's see while we figure out who actually has a working connection. And I am so sorry, but it's normal and healthy. You get.
Bonsoir à tous.
Oui.
Bonsoir
oui,
à tous.
On vous écoute.
Bonsoir Huguette. Allez-y, s'il vous plaît.
All right, we're trying. This happens. Don't panic. And Charlotte, could you summarize for us in English what is being shown on the slide here? What did Abasafiki Binti Huguette, who's a doctor in DRC, actually do following the FGS workshop?
So Huguette says she started implementing her action plan on the 14th and 16th of June by restituting what she learned to the management of her hospital and actually advocating in favor of FGS. So she spoke to them about FGS and the need to take it into consideration during differential diagnosis of different kinds of reproductive health problems that women and young girls could face. And the management was very interested, and she took advantage of that to advocate for that they should make available the colposcope and enough speculums for diagnosis. On the 25th of June, she was able to meet the director of the health zone to also report on the same thing. And because of the pandemic, it was difficult for them to do a face-to-face training, but she used WhatsApp to train about 34 medical doctors on FGS. The challenge that she's facing is medical personnel in her area were having organized a strike action, and so effective work has not yet started. But her desire is to continue to sensitize and train more and more health personnel around FGS. Thank you, Reda.
Thank you very much indeed for summarizing Huguette's story. Unfortunately, we have not been able to hear her firsthand. We have with us Alison Crantel from Bruyère, a Canadian organization, and she has a tremendous amount of expertise on this topic, is a key person in the FAST package. Alison, a warm welcome to you. What are you thinking and feeling with 500 people in this room who came because they're interested in doing something about female genital schistosomiasis? That's question one. And question two, what's your reaction? What are your thoughts listening to Huguette's story in the Democratic Republic of Congo?
Thanks so much, Reda. It was okay. I'll speak in English. So thanks very much. It's amazing to see how many people are here and to hear just the incredible innovation just in the first few stories that we've heard, and appreciating, the use of WhatsApp, for example, is fantastic and a technology that we probably are underutilizing. So it's excellent to see how these ideas are coming right out from the field, and where efficiencies and innovations need to be made, people are adapting and flexible. So it's great to hear the passion and the excitement that's coming out of the group. So that's, I guess, my first, just delighted to be here. And just for Huguette specifically, I took a couple of notes, and just the importance of sensitizing, using the ways that she can get information to people, enlisting individuals who can help her. And I think also there's been a couple of people in the chat. I saw something from Global Schistosomiasis Alliance. There's a lot of materials online there that could be helpful to you as you direct people. Obviously, we're talking about the WHO FGS Atlas, the FAST package website. We're also collecting materials. So there are materials online that can help you as you further sensitize and direct people to more information about FGS. So really congratulations to Huguette, and hope that you're able to resume activities after the strike has finished. Thanks, Reda.
Wonderful. Thank you, Alison Crantel from Bruyère and from the FAST package that you've already heard a lot about. The applause is for both the global experts and people working in endemic countries like Huguette and others. And we have many, many more stories already, things that people have done as we get ready to launch the Female Genital Schistosomiasis, the FGS Impact Accelerator. Charlotte, who shall we hear from next? Yep.
I'd like to invite Julian Ramanantrai from Madagascar, who set out to train healthcare workers on FGS with the help of community leaders. So his mic is already unmuted. Julian, you have the floor.
All right, Julian. I hope we get to hear
Julien,
you.
vous avez la parole. Votre micro est déjà activé.
Madagascar. D'après la formation, d'après la télé que nous avons fait mois de mai, j'ai fait la formation de 5 médecins et 25
5 doctors and 25 community workers. After 2 months of training, we have had great success in the results. 3 doctors
c'est un miracle.
Disease 100%. It's a
Oui, allez-y, Julien. Le son
yes,
est...
please go ahead, Julian. Your sound is very low. If you could raise the volume somehow.
Voilà, cher Julien, si vous arrivez à augmenter le volume ou parler très fort, criez dans votre micro pour qu'on vous entende.
Oui. Un mois après, la télé que nous avons fait était le mois de mai.
In May,
agents communautaires en zone endémique de notre
25 community workers in our district. 2 months after the training, 3 participants told me
des grands succès de l'école chronique et de ménométrorragie. On obtient des guérisons à 100%
we
avec
have managed 100% recovery with praziquantel at 48 grams per kilo, I think.
Yes, thanks, Charlotte. So I could only manage to hear
do you want me to summarize?
Yes, please, if you were able to hear. Yeah.
Julian said 1 month after the workshop, he went and trained 5 medical doctors and 25 community health workers on FGS in an endemic zone. And a month later, 3 of the participants already indicated that great success because they were able to treat 100% of the patients that they had using a single dose of praziquantel. So that is, in a few words, the experience shared by Julian today.
All right. And thank you and apologies to Julian. Actually, not apologies. This is, it's amazing that Julian is able to connect with us at all from the hospital where he works in Madagascar. He is an agent de santé publique, so a civil servant who works on public health in what he calls a very dangerous situation because the endemic zones are remote, and the way he's involved in this plan of action that he developed during the FGS workshop is as a leader and a teacher. So this time I'm going to turn to, let me see if we have, Charlotte, do you see if any of the subject matter experts from Madagascar are in the room? And Ja, if so, could you unmute them?
Yeah, I think I saw Bodo in the room.
All right. I'm asking Bodo to unmute. And Bodo, we'd like to ask you, I think we understood the gist of Julien's story in Madagascar. What is your perspective on, and what would you like to say to Julien? We're asking you to unmute, hoping that you're able to join as well. All right, it would be a sad day if we did not hear from Madagascar, audibly at least today, but that is the way the digital spaces work. All right, we're not going to hear from Bodo. So Charlotte, back to you. Let's go to the next. Oh, I see. Okay. Bodo, welcome.
Hello, everybody. I'm not really fine, and I just listening what happened. But I congratulate Julian for his effort to serve to share information for the medical doctor and community health worker, and I say that he did how to say that.
Si vous voulez parler en français, c'est possible aussi.
If you want to speak French, ma'am, you can too.
Bodo, vous pouvez aussi parler en français, s'il vous plaît.
Ok, il me semble qu'on va pas avoir le Madagascar, pas cette fois-ci.
I don't think we're going to have Madagascar this time.
Mais on est à l'écoute, on est à votre écoute. Si vous arrivez à rétablir votre micro.
All right. Get your mic to work.
Charlotte, you're on the live stream because I'm turning once again to you. Let's try again. This is more than the lottery. We have right now the room is at capacity. There are people who are not able to get in. And so if you are Anglophone, you can go and watch the live stream. If you're Francophone, you will receive the recording, and you'll be able to watch and contribute there. All right, so who is next? We have many more stories. We're already at the 44th minute of this special event, and we were lucky with the first two. Our friends from Madagascar were not as lucky with their connectivity. Who is next?
Okay, so I'm going to go to Nigeria now, Reda. I'm going to invite Dr. Ogechukwu Benedicta Aribodo. I'm asking her to unmute, and she actually, after the workshop, working on a study to reduce the burden of FGS in endemic communities of Anambra State in Nigeria. So over to you, Benedicta Aribodo. Your mic is already unmuted. You have the floor.
Yes. Good evening, good morning, good night, good evening, everyone. Thank you, Charlotte. I'm happy to be here once again, following the development of our action plan. Immediately after the development of our action plan, being an academic, I quickly went to meet with the state NTD coordinator, that's State Neglected Tropical Diseases coordinator. And I gave him the previous results as requested by him so that he can use it and get enough praziquantel for these affected communities. But the challenge still remained because I was keen to assist these young girls and women in these communities because of open defecation that is practiced there, poor sanitation, like I earlier pointed out, and then their inability to understand the what is happening to them because of cultural belief that women should keep quiet, they don't express themselves. Moreover, all their daily activities is through to water. So I decided to tackle their problem from another source, which is tackling it from the root. Because it is important, yes, behavioral change is important and awareness creation is important. But for you to have proper complete eradication of FGS in this community and also promote their sense of livelihood, making them feel more like human beings, there's need to provide them with safe water supply. So in that way, we will now interrupt completely the transmission cycle of the infectious disease of these parasites. Now with that, the competency training actually helped me, like I said, so I decided to work with specific deadlines to achieve my goals. Immediately, I reversed my FGS action plan, thanks to Alison for her contribution. I had that interaction and that helped me. He was pleased with what I presented to him, the state coordinator, and then he provided information on schistosomiasis endemic communities that have not benefited below, and also where the coverage is low. And then also where we can be missing young girls who needed to be treated. But then again, he also, the great milestone I encountered was he accepted to be my co-investigator in the research I did. And this was very insightful because this helped me to develop our study protocol to suit what was required. So we decided to go for to have a pilot study before going into the field proper. So what part of things we did were to start, we administered some questionnaires and to some women that had August meeting, and we found out that there was low literacy level. We are still processing the information so that I can send it to you for you to see by the time the data is out. Now, the major thing I did after that, I started teaching in the classroom about this, conducting seminars in schools, trying to speak with health professionals that I know so that they will know about it. And overall, I think I did sensitization with 287 people. Now, I noticed finally that the major challenge that I have, because I applied for 2 grants to see if I can source for money, knowing that my action plan, part of the way I said what I'll be provided for them is by crowdsourcing for funds from philanthropists so that we can have a steady water supply for them. Then again, that would now be managed by the community members. But I have to have plan B should this one fail. That's why I went for the applying for funds. So that made me to do just physical survey on the surrounding to add to the grant form that I submitted to TWAS, and I submitted to TWAS. Then I submitted to TED Fund equally. So the summary of this that we found out, lesson learned, is that action plan is very good, but remains subject to modification as other factors can affect the possible outcome of the study. Thank you.
Thank you very much, Ogechukwu Aribodor. We're going to go to ask Dirk Engels for what he heard and what he'd like to comment, feedback, share insights with Ogechukwu about her project. Before we do, though, Ogechukwu, I want to ask you, do you feel at this point in time ready to make this commitment to the Scholars Pledge for FGS?
Yes, I do.
All right. And will you be joining the FGS Accelerator on Monday?
With my whole heart, I will. I want to help these girls.
All right, let's now go to Dirk Engels. Dirk, I'm asking you to unmute. Yes, please go ahead.
Can you hear me? So,
loud and clear.
Yes, I can hear you.
Yeah, first of all, congratulate the lady that we've just heard.
Thank you.
Please do introduce yourself, Dirk. Yes, what do you know about FGS?
Oh, sorry. My name is Dirk Engels. I have worked for WHO for 20 years. I retired from WHO in 2017 and I'm still continuing in the field of NTDs, mainly advocacy for NTDs, because I think that is greatly necessary. Now, just for the participants, my first contact with FGS was very early in my career, in the early 1980s in Zimbabwe. In Zimbabwe, we knew about it because the University of Zimbabwe and professors at the University of Zimbabwe, of which one of them was Michael Gelfand, had published about it. But I've always, throughout my further career, I've always been surprised and disappointed that nobody knew much about it. So it has taken actually 40 years for this disease or the consequence, this consequence of schistosomiasis, to bring it actually to visibility. So you won't be surprised then if I say that I'm absolutely thrilled to see 500 people in this room and to hear about the enthusiasm actually of all of you. Now, what particularly strikes me and what pleases me actually is this awareness after these FGS trainings. Hey, yes, we are seeing those cases, right? If you don't know about it, you won't see them. But if you are aware of them, you do see them. And then the second positive aspect to me is you've all made some efforts for a cascade effect. You know, you have had the training, but you've passed it on to other people in your working environment. And then the third good news for me is you've seen that praziquantel works and that there is something to be done about it, and that there is something to be done about it up front. You know, you don't have to wait until the symptoms are totally established. There is something to be done about it. So these are three issues that I must say that are the really positive consequences of this training. And again, I can only say that I'm absolutely thrilled about it.
All right, thank you very much, Dirk Engels. Boy, over 20 years of experience versus neglected tropical diseases and FGS in particular. Before we continue, and actually we are 7 minutes away from closing time. Now, at the top of the hour, what we'll be doing is we'll be giving a briefing. We'll be first of all announcing who has been accepted into the FGS Accelerator. So we're very excited and waiting for that moment, and I'm sure you are too if you are amongst the alumni. Everyone is welcome to stay, but it will really be focused on the needs of the alumni to get ready for the FGS Accelerator that will kick off on Monday. Again, to go back to the all participants in this special event will be receiving a critical resource, a set of frequently asked questions on FGS developed by the subject matter experts involved with this FAST package in response to the questions that workshop participants had during the workshop. So you will all be receiving this, and we'll also be sharing a set of resources to help you learn more about FGS. Before we close, I am also very pleased to share via Bridges to Development this research grant opportunity from Merck Global Health. So this is not only for FGS workshop alumni. We'll be sharing the full slide deck. You can see the email here. So if you are seeking funding, if you know that funding could make a difference in accelerate your progress for the project, the work that you're leading on FGS, please take a note of this. Now, we have just 6 minutes remaining. I'm going to go back. There are many people following us on social media. In addition to the 500 in the room, I know some of you haven't been able to get in because that is the capacity of the room. We actually had over 2,000 people, Francophones and Anglophones combined, who registered for this workshop. And I know many of you will be watching the recording as well. So let me go to, all right, so Naji is connecting from Ethiopia, from Addis Abeba, Valerie Muzimba from Lubumbashi in the DRC, Hortense Makonga, who says bonjour à tous, Hortense depuis la ville de Likasi en RDC. J'ai voulu être dans la salle pour mieux suivre l'interprétation en français, mais la connexion me complique dès le début. J'en suis navré, mais
to follow the French interpretation, but my connection is quite bad. I'm very sorry about it.
Annabelle says, connecting from Kasama, Zambia. Let's see, Ojabe, John from Nigeria. All right, Elham, please, once you've said hello, let us know what you're thinking, why you're following this, what you're getting out of it, what you're finding interesting, what your questions are. Samuel Chukwuemba Obasi says, great stories, quite insightful. Little effort could mean so much to someone. Very encouraging. Rosemary Mahmoudou from Nigeria. And Amel El Tahir. Hello, Amel, and good to see you again. Sanjali Traore, who's just been connected. All right, we have 4 minutes left. I'd like to turn back to Julie Jacobson. Her thoughts after hearing, with some pains, but with no pain, there's no gain. Julie, what are your thoughts as we... in the last, what are your closing or parting thoughts at this point, knowing that we're actually kicking off the Accelerator on Monday?
So I'm thrilled, as Dirk said, it's thrilling to see so many people interested and willing and to take on this and be a champion for such a neglected and lost cause that's been hidden in sub-Saharan Africa, and the women and girls that have suffered from this. I feel hope for them, that there's a group of people that are willing to take action and to see, because this has been happening for a long time, and now there are solutions for this. And I'm very happy that from the time of bringing people together in the initial training, that so many of the messages have come through, that we can prevent this. There's an environmental exposure to the parasite. It is in the water. If we can decrease the exposure, we can help. If the treatment is available, and that you don't have to wait for diagnostic tests and expensive things to do this. Presumptive treatment, because the treatment is very safe, is good to do, and it gets the parasite out of the body. We have to treat women, girls, and boys and men to stop the transmission. So I'm extremely energized and excited about the next steps, about working with and seeing the great work that you all will do in your countries to be able to solve this problem and decrease the suffering of women and girls from this that have been suffering this for many decades. And it is preventable and treatable, and you all will be part of that solution. And the emphasis on education, just sharing what you've learned, because it is going to be local innovation, local problem solving that's going to make this happen. It will not be anybody from outside. Remember that there is an opportunity to get some resources through the slide that Retta just said, through Merck Global Health. So if you have a specific project that might need investment through that, please do apply. Note that it has to be in by October 31st, so there's a short timeline. I'm inspired by all of you. I am greatly inspired. So thank you for your efforts and you being part of the solution.
Thank you, Julie Jacobson from Bridges to Development. Now we are going to announce the list and should present the list of participants who completed the FGS workshop and who have now been accepted into the first FGS Accelerator. Now, whether or not you are an alumni of the workshop, whether or not you applied for the Accelerator, you're welcome to stay on. We'll be giving a short briefing to really give you help. Those of you who have been accepted into the FGS Accelerator, prepare, because we are kicking off Monday. We're going to go very fast, and hopefully we'll keep going faster. So here is the first screen for the Anglophones of the 44 scholars who have been accepted into the FGS Impact Accelerator. If you don't have the time to see your name, you'll be able to check later, but if you applied, you should be, and you put effort into your application, you should be in good standing. So these 44 scholars, this is page 1 and then page 2, will be starting on Monday with the Accelerator. And we'll be telling you more in the briefing about what the specifics, what that actually means. So those are the Anglophones, 44 Anglophones and 56 Francophone scholars who've been accepted into the Accelerator for female genital schistosomiasis. So as you can see, the first page of names here. Don't panic if you do not see your name right away. And here is page 2 with the remainder of the 56 scholars. So now it is in your hands. You are doing this because you want to. We invited you, you responded to the invitation, and now it's time to take action together. Many of you are already doing a lot together. The difference is this time you're going to be able to do it together in a connected way, connected to each other and connected to the global experts, our subject matter experts who were very, very supportive on this process. All right, so this is it for the special events. We're continuing with a briefing, so if you want to know more about the Accelerator, stay on. We'll take a 30-second pause and then dive back in with the Accelerator briefing. So please, if you're accepted into the Accelerator, please don't go anywhere. We need you to receive this briefing. Make sure you're up to date. You understand what you need to be doing starting on Monday. All right, this is the participant briefing now. Going to go very quickly. We'll be sharing the recording and the slides. So if you don't understand everything right away, don't panic. Don't worry about it. We're going to be here to support you. Charlotte, can we count on your support to participants throughout the Impact Accelerator for female genital schistosomiasis?
Definitely, Reda. I will be available every step of the way.
All right, that's wonderful to know. Now, let's rewind and start at the beginning. You developed an action plan during the FGS workshop, and really the Accelerator is to answer a simple question. Are you actually ready to take action? And in the application, we ask you to commit to this pledge, but it's not just a checkbox. It's really think, are you ready to do this? And some of you may realize that you're not, and that's okay. Because the Impact Accelerator is not for everyone. It is for the most committed amongst you, for those of you who really yearn to go further and to do it connected to fellow practitioners, colleagues from all over the world. Now, in practice, what does it look like? Well, it's 2 weeks where you're going to focus on a very specific goal, and you're going to be working with peers, and you're going to be leading as peers, but your focus is actually, your single-minded focus is actually going to be on where you work and where your action plan is to be implemented. This is not a training. The Accelerator is not about training. You will pick up the knowledge that you need, hopefully, in order to solve the problems that you're tackling for your action plan. But the point is to set a specific goal you would like to achieve by the end of the 2 weeks. And then every Tuesday, so 2 Tuesdays in a row, there's going to be what we call the General Assembly. And that will be kind of like the special events, but only for people who are actively taking action, trying to take their action plans forward and to achieve the goal that you have set as something that is realistic, that you can do by the end of the 2 weeks. And then along the way, we'll be asking you to share and report on your progress. And we'll be sharing again the successes, the lessons learned, the challenges. So if you encounter a problem, something that you can't resolve on your own or with your colleagues in your workplace, well, you can call on fellow scholars in the Accelerator and ask them, have you encountered this before? Can you help me? And maybe some of the subject matter experts, some of the global experts who are involved with the FGS workshop will accept the invitation to come also support and help you and give you feedback and listen to your work as you're making progress, or as you're striving to make progress. Now, it's a very simple timeline here. Altogether, there is a little bit of extra work. But again, it is not a training. So it is not about hours of training time. It is about the times when you're going to connect to each other, to learn from each other, to support each other, in order that you can focus the time you have. If doing this is part of your job, the Impact Accelerator, if you're doing it right, is actually about just doing your job, but with a superpower. What do I mean? The superpower is this connection that you have with practitioners from all over endemic countries, and the connection to global experts when and if they are able to help you. So we want you to think about, as you prepare for the Accelerator ahead of Monday, think about your implementation strategy. In the context of the workshop, yes, you developed an action plan, but no action plan has ever been successfully implemented that was developed in a corner somewhere. So obviously it's about figuring out the next steps, bringing everybody on board, people in your workplace, your boss, your donors, the communities that you serve and that you work with, figuring out what is the timeline and budget. And we're not going to be training you to do this. We're going to be supporting you to connect to each other so you can help each other do this. That is very different from a conventional training approach. Nevertheless, together with Bridges Development, we will be offering a certificate. What are we certifying? We're certifying that you signed the pledge, so that you've made this commitment. We'll be certifying that you were actually present and you reported on the efforts that as you made them in, of course, a quality way, in a reliable way. And the next steps really are today. You will check your inbox because you're going to receive your letter of acceptance. So and you'll be able to check if your name was on the list. But for those of you who applied, you should be okay. Second is we'll ask you to register for the General Assemblies. This is a one-time during the Accelerator, what we call a launch pad, where you'll be coming together and sharing successes, lessons learned, and challenges. So if you appreciated this special event today, that's basically what we're going to do 2 Tuesdays in a row. But the real work doesn't happen in the assemblies. Those are moments when we motivate each other, hopefully perhaps even inspire each other. The real work is in how you're going to, the steps you're going to take, the actions you're going to carry out to actually implement your action plan. And of course, it's just 2 weeks. So what's the point, you may ask? Well, it's what we call the launch pad. It's really about taking off. And you know that in order to take off, that is when a plane burns most of its fuel. But once it's up in the air, you can fly with your own wings and you can glide for a long time to get to your destination. So that is the spirit of the Impact Accelerator Launchpad. We're conscious of the demands on your time, so there'll be very simple activities we'll ask you to do. There'll be some things that you can optionally do if you feel they're useful to helping you make progress. The one activity that is actually key is what we call the remote coffee. And you're going to receive, as part of the letter of acceptance or right after it, an invitation to meet with someone else who is in the FGS Accelerator. Could be someone from your country, could be someone you know, but most likely will be someone from a country different from yours who is also working, who has also made this pledge. And the brief for the remote coffee is very simple. Just enjoy each other's company, get to know each other, do what human beings do when they meet and they realize that they have a shared purpose, something in common. And then on Monday, we expect you to really kickstart, taking the actions, figuring out, mapping out what you're going to do next week. It's soon. It's not, a long-term thing. And the goal can be very small. It can be by the end of the week or by the end of the launchpad, I will have presented my action plan to my boss and hopefully secured his or her support. It could be I will have done a focus group discussion with people in the communities that I'm trying to help. You will know what you need to do. And then the real question is, once you set a goal, can you do it in 2 weeks? Because that is going to be very important in order to succeed in the accelerator. So that is the overview. I want to open up to questions, and I'm going to maybe take all the hands down. I actually don't know how to... oh, right, it's Ja who needs to take all the hands down. And then if you have questions about the accelerator and this briefing, there'll be more information coming your way by email, but we'd love to hear what your questions are at this stage. And Charlotte, can I turn to you? Do you know if these are new hands or hands that have been there? And I'm so sorry, every event like this we never have enough time to hear from everyone. We would love to, but then we also realize that you're very busy. Charlotte, how is it going?
Rather, I have a feeling that these are the same hands that were already raised, but there is nothing wrong with, I can recognize some alumni and some people that will be members of, that will be participating in the Impact Accelerator. So we could turn towards them to hear what they have to say in terms of questions or what they think about the Impact Accelerator and the engagement, the pledge that they have taken.
Okay, who should we go to then?
So we could start with, we have here Dr. Gla Paul Emile. Dr. Gla Paul Emile, your hand has been raised for quite a while, so you can go ahead and unmute yourself.
All right. Let's call on several people maybe and see who. Yes.
Bonjour. Dr. Gla Paul Emile, Christiane Isabelle de Côte d'Ivoire.
Gla Paul Emile, Christiane Isabelle from Côte d'Ivoire. I participated in the setting up of my action plan after the first meeting. In charge of the program for against neglected tropical diseases in Côte d'Ivoire. I would like you to give him the floor so he can explain what the level is in Côte d'Ivoire. He was to create my action plan, and he is in charge of the program for neglected tropical diseases, and I would like to pass him the microphone so he can explain the circumstances in Côte d'Ivoire.
Hello. Oui, merci beaucoup, Dr. Gla Paul Emile. Malheureusement, la séance, l'événement est arrivé à son terme. Donc,
the event is coming to it. For participants of the Impact Accelerator.
Je ne sais pas, Reda, vous avez quelque chose à ajouter?
Non, merci Charlotte. Effectivement, l'événement est terminé, mais I'm going to switch back to English. This is only the beginning. Throughout the accelerator, if there are individuals, whatever kind of stakeholder you are, from the Ministry of Health, from an endemic country, or from the global or regional levels, please do get in touch. I'm sure there will be many opportunities to connect you with the FAST package, with Bridges to Development and other partners working in this area. I'm showing once again the list of names of scholars accepted into the first FGS Accelerator. Who shall we hear from next, Charlotte?
Reda, I would like to turn to, we have here Akinjide Ani Fowose. Akinjide Ani Fowose. And then maybe afterwards, Reda, I'll just ask you to lower all hands and then we'll see if there are other people who have questions around the Impact Accelerator. So Akinjide, if not, we can take Mohamed Nasiru. Mohamed Nasiru, go ahead and unmute yourself if it's possible. Okay, we also have Majuana Razo Ambari from Madagascar. Surely. Okay, so Mohamed Nasiru, your mic is unmuted. You have the floor.
And again, we're looking for specific questions on the FGS Accelerator process. Any questions you have, if you're an alumni, you've been accepted, that's great. If not, you may still be curious and have questions. We're listening.
Mohamed Nasiru, your mic is unmuted. We can take another person, Bie Liliane Bando. Bie Liliane Bando, I've also asked you to unmute.
You can also type your questions into the chat. So if you have, if you have any, if you're having problems with your microphone, but you have a burning question, okay.
And Reda, I'm seeing comments from Francophones in the chat expressing concerns. It's as if they are not hearing the interpretation in the French language.
Yes, there's saying, yeah, so that's probably their connection. Unfortunately, there's nothing we can do about that, but we will be sharing the recording for this. So, and let's see. So there is one person, Françoise Fouté and Wabufo, who says, I applied some time ago, was not accepted. I'm from Cameroon. And at the time you said that the workshop was not yet in Cameroon. So indeed, the fast package workshop that took place in May and June was focused on 2 countries. And the fast package is still focused on those 2 countries, Ghana and Madagascar. The Geneva Learning Foundation, the way we work, however, is every initiative we do is global. We invite everyone. We may have some constraints on a specific workshop or initiative, but the Impact Accelerator certainly is open to alumni of the FGS workshop who have successfully completed, earned a certificate from that workshop, and then applied for the Impact Accelerator. This event today, I believe, shows that there is a need greater than what we may be able to meet with this initiative. And I hope that the FGS partners, the wonderful folks who've been working on this issue for decades, will seize the opportunity and find ways to engage with you that we would be happy to facilitate. Barima asked to see the list again, so let me go back to the list of Francophones. So it's in alphabetical order by first name. And again, if you have, all right, let me just lower all the hands because there are many hands raised while you look at that list. And let me move myself out of the way as well. And so we can actually see. And please lower your hand unless you have a question specifically about the FGS Accelerator. And of course, you had to have applied for the FGS Accelerator in order to be accepted into it. All right, let's hear from... all right, so Donia, we heard... whoops, I just lowered your hand by accident. Let's hear from Tina Irugami. Tina, love to hear from you. Do you have any specific... What is your specific question about the FGS Accelerator?
Good evening, Rita, Charlotte. I am happy that I was able to attend this session today. I just want to find out if I have been a member of the Accelerator, Impact Accelerator program. Does it automatically induct me into the Accelerator program for the female genital mutilation program?
No, thank you for that question. So as you are an alum of the FGS workshop, you received the invitation to apply. So that application process needed to be completed by a deadline that is now closed. And then applicants were selected and announced today. So I hope that clarifies the process.
And whether if I could just add, because that is this accelerator is for FGS, that's for those who took part in the FGS workshop. We know we have participated in other accelerator programs that were open for those who did other courses, but this one is for the FGS workshop.
Okay, thank you, Charlotte.
Just for immunization staff who are participants in the Geneva Learning Foundation's immunization program, I have good news, which is that we're about to announce the next Impact Accelerator launchpad specifically for immunization. So the idea is that this process we're connected to each other, we can work better and faster and connect to global expertise as well to accelerate progress on implementation and ultimately results and impact. Are there other questions? Let's go to Olubunmi Olalekan. So I see 3 hands raised. So if your hand was mistakenly taken down, please do put it back up. We have another 12 minutes to take your questions and really make sure that, especially for the FGS alumni who've been accepted into the Accelerator, that you understand what you're going to be doing starting on Monday. Olubunmi, are you able to unmute? I'm asking you to unmute. And then we also have, let me see, thought I saw another.
Yes.
Yes, Olubunmi, warm welcome to you. Tell us where you're connecting from, who you are, and then what is your question about the Accelerator?
Okay, my name is Olubunmi Olalekan. I'm a medical parasitologist from Lagos, Nigeria. This is the first time just joining this program. I just want to know how you can be part of the Impact Accelerator program, because I know I have 2 weeks. I have free 2 weeks next. I don't think I did apply. So I just feel I can be part of this program in Lagos, Nigeria. Thank you.
Thank you, Olubunmi. So the Impact Accelerator, again, is the application process was only open to participants in the FGS workshop that was held in May and June of this year. However, this event shows that there is a demand for more learning opportunities, and that is what we certainly hope to offer, working with partners in the near rather than the far future for individuals like yourself who have that motivation and that yearning to go beyond, to do a little more than what is perhaps expected of you, and who pledge to work together to achieve results and ultimately impact. So that's probably not a satisfactory answer, but that is how we are working with this particular accelerator. But this is the first one, and we certainly hope, if there is interest and if partners who've been working on FGS for years find this to be a useful process, we certainly hope and will be striving for there to be more. Thank you, Olubunmi, for that question. Let's go to Brahima Traore. And then we have Manasseh Chitenge. It would be good to hear from Francophones as well. You are able to ask your questions. It will be instantly translated by our interpretation team. On vous écoute.
Allô, voilà, je pense que pour ma part, j'avais la même préoccupation que la précédente. Donc,
I have the same question as the previous speaker, so I wanted to know how to participate to the Accelerator program, but as you have already given the answer, thank you, and I was really happy to take part in this workshop. Thank you very much.
Thank you very much indeed. Let's go to Manasseh Chitenge to hear your question, Manasseh.
Parce que c'est la première fois que je participais,
the first time that I've participated.
That was the first time I was part of it, so I started to work in May, and I wanted to know how you could be part of the Accelerator per se. I understand that the answer was given already. Are there any other opportunities? Because we're always ready to access because thank you very much in any case.
Thank you, Manasseh Chitenge, for that question. So currently there is no other activity planned, but we will be encouraging partners who work on FGS and engaging with them to respond to the expressed need here. This is very exciting to see an event like this come together. For the Geneva Learning Foundation, this is what we hope for, that people will respond, that health professionals will take up the call on these challenging issues. So the best way to stay informed in practice is keep an eye on your inbox. We have some people, take that to make sure our emails do not go to your spam. And when you receive an email, then you should read it carefully. We almost always get, Charlotte can confirm, a few people who are disappointed just because they missed the invitation to apply, they missed the call for applications. There's another a kind of a secret channel. I'm sure you're all familiar with WhatsApp, but we actually use a little app called Telegram, and you can just Google Telegram for Android or Telegram for iOS or even on your laptop computer, and install it. And we're going to be sharing tomorrow a secret link that will make you a member of the FGS channel. And that is probably the best, most immediate way to receive information about the next learning opportunities. Thank you for that question. Charlotte, I've lost track, and there are now like 9 hands up, and we have 7 minutes left. So do you see questions in the chat, or do you choose someone that we can hear from firsthand?
Okay. So many questions in the chat, but I'd rather we listen to someone that we haven't heard from. There is Dr. Syed Mohammed Hussein. Your hand is raised. Please, can you unmute? If not, I'm going to turn to
Good evening. Good morning.
Please go ahead.
Good afternoon. This is Dr. Syed Hussein from Afghanistan. We have thanks from all, special thanks from Rita. This is good innovation for all. Just we have also the same challenge, like no safe waters, no good knowledge with health workers about the FGS. Also, the health workers treating the FGS as a PID. Also, we do not have the lab for the FGS. So, how we can prevent from this disease? Also, how we can to give the awareness to the community? This is my questions for our challenge. Thank you.
Thank you very much indeed. Now, I'd like to hear, obviously, there's been a number of the questions are from folks who are not alumni who'd like to know more about this initiative. So perhaps I'd like to turn to Julie and Alison. Let's start with Julie. Just what can you say in response to the expressed need we're hearing from practitioners today?
First off, we're overwhelmed by the enthusiasm and the interest in tackling this problem, and we've heard that, and we've heard that we need to figure out a way to repeat the training so that we can bring in the next group of scholars who can then take on and come up with plans in their area. To the specific question from Dr. Saeed, the parasite is predominantly in sub-Saharan Africa, sub-Saharan Africa. So this parasite is not around the entire world. You see schisto in many different places, but this particular manifestation is seen in sub-Saharan Africa. But there are other parasitic infections that affect the genitalia of women and men that need to have attention. But here we're focusing on schisto and the particular manifestation that we see mostly in sub-Saharan Africa. And I think Alison and I have heard the desire for more training on this, and from we will work to try and help see how we can do that, but also link you to resources that could be of help. So we'll work with the Geneva Learning Foundation to reach out to you with resources that could be helpful in between the time that we could bring people together for these real important problem-solving sessions where the real innovation and where the real impact will come is from these kind of sessions. So thank you for your interest. I don't know if Alison has anything she would like to add.
No, that sounds great. I would echo everything you said. I've put it up a couple of times, but the chat keeps sliding up. I'll put in links to 3 particular websites that do have information and also contain resources and links to some of the recordings from the online session. So I'll make those available again in the chat just as an intermediate option. But as Julie said, really overwhelmed with the excitement here, and we'll certainly are aware of it, and we'll do our best to see how we can go forward with this. Thanks.
All right. Thank you very much indeed. All right. We're at the 28-minute mark. So Charlotte, I'd love to hear to close with your reflections on this event.
Thank you so much, Reda. And I also want to thank all the subject matter experts that have been here this evening to contribute. But I want to mostly also thank the alumni I know many could be disappointed that we didn't get to listen to your story today. But I think if we have really listened to what has been said by Julian and Alison, we do hope that there'll be more opportunities in the future. And just to promise you, over the next 2 weeks with the Impact Accelerator, for those who will be taking part, I'm sure, as Reda said earlier, during the General Assemblies, that's every Tuesday over the next 2 weeks, we will get to listen to you tell us about the progress you are making, the lessons you are learning, the success stories, and even the challenges. And together, as is always the case with the scholar community, we can see how we can learn from one another and move forward with solving those challenges. So I really look forward to seeing you again. Those who have been who will be part of the Impact Accelerator, look forward to seeing you next Tuesday. Please keep your eyes on your mails and on the Telegram channel. And for those who will not be joining us, we do hope in the nearest future another opportunity like this one is going to show up, because FGS is a public health concern in sub-Saharan Africa, and together we can tackle it. So thank you all, and over to you, Reda. Thanks again. Reda?
Let's see if we can make some noise. Yes, and say goodbye to each other the way human beings should be able to do even in digital spaces. Take care.
We'll try to share more
Thank you.
Au revoir. Bye bye all, and thank you so much.
Bye everyone, thank you.
Thank you.
Au revoir. Merci beaucoup.
Au revoir.
Bye bye.
Bye.
Bye.